Hello, this is Eddie Garcia, Senior Vice President at Healthsperien, and this is For the Health of It. For the Health of It is a weekly podcast covering all things health policy, brought to you by Healthsperien, a nationally recognized health policy consulting firm focused on federal and state regulatory and legislative analysis, advocacy, and business strategy. On today's episode, the Healthsperien team and special guests will focus on the behavioral health impacts we face as a nation due to the coronavirus pandemic. We offer a discussion of the federal actions taken to expand access to behavioral health services and what still needs to be achieved to ensure that all Americans can get the urgent help they need, physically, mentally, and socially. We dive into the obvious, personal grief and trauma that a number of us face dealing with the COVID infection or loss of loved ones. But we also examine more inconspicuous, but very real, anxiety and social isolation that the majority of us are grappling with day to day. Up first, your weekly Healthsperien, a moment to reflect on the bigger picture.
Hi, this is Ray Quintero, Managing Partner with Healthsperien. As we think about the impact on mental health, we have to think about the importance of resilience. We will come out on the other side of this. And as we think about this and understand the needs of society and the way in which we've changed, even so far through the COVID response, we've also understood that we've already begun changing our behaviors. We've already begun working together, being more mindful, and also thinking about what our renewed purpose is, whether we're individuals, whether we're corporations, whether we're associations, or whomever we are in the healthcare ecosystem. We're already starting to understand what our sense of mission is, and also beginning to understand how we need to be working collectively to work toward a recovery. And as we move toward that recovery, we also need to understand that we will be able to overcome any challenges that we've faced when it comes to our mental health. And we also need to understand the importance of taking care of our mental health today, tomorrow, and on the other side of COVID-19.
Now join Healthsperien policy experts and friends for Stay in the Know, a weekly policy segment on the top health policy issues we're facing this week.
This is Andrew McPherson, Managing Partner at Healthsperien, and I'm just thrilled to be joined today by three experts in mental health and in the healthcare arena: Carol Fisher, Dr. Lynn Bufka, and Andrew Sperling. Thank you again for joining us today. We're going to begin with Carol. Carol, my gosh, you actually had coronavirus. We're so glad that you're feeling better. Talk to us a little bit about your firsthand experience with the virus and some of the mental health issues that you experienced throughout that process.
Yeah, well, thank you, first of all, Andrew, for having me here today. And I'm really fortunate to be here today as a COVID survivor. It was several weeks ago that the first day I wasn't feeling real well, and then the speed at which I got sick was rather impressive. So I found myself kind of bedridden for a couple days, not able to do much, just extreme fatigue. You know, emotionally, what a challenging issue, because we're all seeing so many negative outcomes with this tragic outcomes. So certainly I had some fear, experienced some anxiety. I was aware, I think is probably the best way to say it, that I had to make sure if I got worse, or my significant other who actually had it 2 days prior, so that was his gift to me. You know, I had to make sure that if we declined, that we immediately found ourselves into the emergency room.
Thank you. Wow. Yeah. I mean, tell me more about, if you don't mind, the anxiety that you're feeling. I think, we've seen studies coming out now that the majority of Americans are feeling some level of anxiety, whether they have coronavirus or not. Tell us a little bit more about how you managed those emotions and those feelings throughout the process. I mean, there's so much, we're still learning about coronavirus, it seems like every day from a clinical perspective, but tell us more about how you manage that.
I think one of the things that we need to all keep in mind is that there's no examples of how you experience a pandemic, because we're all experiencing this for the first time. So for me, I didn't have anyone really to call and say, is this normal? Is this not? And certainly in my world, I have a lot of physicians and nurses I can reach out to. But the anxiety was high because you hear such tragic results from folks and just horrible. So I did a lot of staying off of media. I didn't want to see what was happening out there.
Sure. And tell us a little bit, I mean, as a former CEO of a major healthcare organization and now a leading consultant working with other healthcare executives and focusing oftentimes on vulnerable populations, how is your experience with coronavirus translated into your day-to-day work life? And how are you applying some of those lessons from what you experienced?
Well, I'm very eager and happy to share my story, and people are very interested to hear what I experienced, what the symptoms were. I had just yesterday a couple people call me saying, I think I'm sick. What do I do? And I do want to say to everyone, if you have this virus, you will definitely know you have this virus. It's not like a regular simple flu. So I spent a lot of time in conversations with people, Andrew, sharing my story and sharing my experience, because there is certainly a heightened level of concern these days for everybody.
Yes, no question. Thank you. And we really appreciate you sharing your personal experience with us today. Dr. Bufka, talk to us a little bit about some of the clinical aspects of the pandemic and what you and the American Psychological Association are seeing as the situation gets worse.
This is, as Carol said, this is unprecedented. None of us have experience dealing with a pandemic. This is the kind of situation that is ripe for individuals feeling highly anxious, and for now that we're into the period of physical distancing and really not having those kinds of social contacts, for people to experience more depression as well. This is a situation that's incredibly uncertain, it's ambiguous, the threat of the virus itself is invisible. So it's all things that make us anxious because we don't know what to expect. We don't know what it is that we can do necessarily, and the information we get changes on a regular basis about sort of what's the best practices for staying safe. So we are seeing more people reporting higher levels of stress. We're seeing the potential for developing more anxiety problems, for the potential for depression as people feel isolated. And we certainly anticipate that there will be some individuals, when all of this is said and done, to have what we call post-traumatic stress disorder. That would be both frontline clinicians who are facing really difficult situations with the vast number of individuals who are seriously ill and having to make difficult care decisions, as well as individuals who are isolated, self-quarantining for a longer period of time, and all of the individuals who are really struggling to have the resources to continue their lives because they're not able to work, they don't have access to the income that they had, they don't have some of the things that most of us would consider reasonable in order to live their lives. So we anticipate that there's going to be some significant long-term consequences here.
Yeah, I mean, it's incredible to think about the co-occurring challenges that everybody's facing from a healthcare perspective. Talk about what some strategies are from your perspective, from the field, on how to manage those symptoms, whether you have coronavirus or not, how to manage that stress and anxiety, particularly as we isolate.
It's hard right now. And I think it's fair for all of us to acknowledge that this is a difficult situation. It's new. There's no roadmap. We don't know exactly what to do. But in order to cope with this situation, getting some sort of handle on our emotional experience is important. Acknowledge what you're experiencing. Recognize that it's distressing. It can be hard. It can be very difficult to feel disconnected from friends and family. So first of all, acknowledge that's what's going on. And then try to figure out strategies to help cope with those feelings so that you can look towards what are the things you can do something about. How can you problem solve to meet your needs, to address the situation at hand? So that's sort of the overall framework. Recognize these tough emotions and then cope with them in ways that are helpful.
Excellent. And talk more about this notion. Carol mentioned that one of the things that worked for her, that was important to her, was to only, and I think we're hearing a lot about this, to only consume as much of the news as you need to stay informed. Is that a good strategy? How do you recommend, or does the American Psychological Association recommend that we manage, understanding what's happening in the world, but also not taking in too much information to lead to anxiety and to exacerbate mental health issues.
Yeah, that's a critical one, managing the amount of information we have, because the virus is unknown and information changes, is conflicting. We don't always really know what to make of it. We can get overwhelmed with lots of competing different kinds of information. Also, the news, as Carol was pointing out, really focuses on how many people have really negative outcomes as a result of the virus. We don't hear daily updates for how many people are considered to be recovered. Gosh,
Right.
It would be nice to see that. It would make us feel a lot better that there is hope. So it becomes really critical then to manage how much news you're exposed to. Some people do okay with a good amount of news, other people don't. Try to understand what your own style is on that and
Yeah.
decide some boundaries. Maybe it's I start the morning checking the news, but I don't look at the news after 6 o'clock at night.
Mhm.
Or I turn off information that I get from my smartphone, so I'm not getting a constant feed of updates. Because the reality is, most updates are going to be repeated over and over again. You're going to find them, and it's unlikely to change what you're doing in the immediate moment. So the more you can control how much of that news is coming towards you, the
Yes.
more you're going to have a better ability to manage your emotional response to it and decide how you want to act.
Yes, definitely. Speaking of sort of repetitive information, we're hearing this term social distancing almost ad nauseum. I think we all understand the term. I know that guidelines seem to be shifting away from the term social distancing to physical distancing, recognizing that social connectedness is so important throughout the response to the pandemic as we intentionally isolate. Talk a little bit about how to maintain social connectedness and the importance of trying to avoid being lonely during this really challenging period.
Sure. I think it's so critical that we think about it as physical distance, not social distance. And I'm glad to see that that's changing, because we need social support. We need people in our lives for our overall mental well-being, whether it's in the midst of a pandemic or even if it's just your everyday go about the business world, right? So figuring out ways to stay connected to the people who are important to you is critical. We are blessed with an array of technology that we didn't have 15 years ago in order to do that, but it's not accessible to everyone. So think about the kinds of ways that you can connect that are comfortable for you and that you have access to. For some people, that's going to be phone calls. Reach out to people, talk to people on the phone, establish a regular phone date with your best friend or your daughter or somebody from your childhood that you would love to stay connected to. Figure out ways that you can focus on the things that you share in common. Don't spend all your time talking about coronavirus. Talk about the things that keep you connected to that person, whether it's a common love of reading or discussion about what's going to go into the garden and what's blooming right now, or whether it's reminiscing about past trips together. What we want in our social connection is to feel close to others and to have that sense of intimacy. We might have to be creative about how we do it, but it's possible to do it.
Yes, I know that my fiance has asked me at times to say, can we take a break from talking about the pandemic? And she's right. It's easy to get caught up in sort of all that's happening. And I think that's really, really important advice that you just gave. Andrew Sperling from NAMI, talk to us. Boy, this has just been an extraordinary period for policy change at the federal and state level. We've seen now 3 major legislative packages move through the Congress at light speed. We've seen the Centers for Medicare and Medicaid Services, CMS, allowing for a whole range of new flexibilities for providers in particular. Talk to us about some of the changes that we've seen for providers, mental health providers and professionals, also what you see sort of in the future.
So a couple of things. Number one, it's important to recognize that many of the changes that have been enacted by CMS, by the Trump administration, and in these 3 large bills that have moved through Congress, is that for the most part, many of these are going to be transitory or temporary. In other words, for example, lifting restrictions on telemedicine, for the most part, those are likely to be time limited. But the important thing is the information, the data, and the research that we do during this period, maybe potentially even looking back, would allow us to say, wow, that really worked well. Maybe we ought to enact that on a permanent basis. And I think that's going to be very, very important for us to do, to carefully, as best we can in this crisis, assess what went well in terms of expanding access to care in difficult situations so that the next time we're having to deal with something this, and we all hope that it's never, again, anything on this scale, but there are going to be new viruses over the next decade or so, and learn the lessons from what we did right and did wrong in this period of crisis.
Excellent. And talk to us like specifically about, from NAMI's perspective and from your perspective, are you feeling like the government has gone far enough to provide tools to providers and to patients who are, as we see this explosion of challenges, mental health challenges that individuals are facing, do you think the government's gone far enough? Or is there more work to do?
There's a lot more work to do. I want to draw attention to one particular issue that NAMI is very concerned about. And it is individuals on the more severe end of the spectrum with particularly like psychotic disorders, bipolar disorder, schizophrenia. They are more likely to be living in situations where it's very difficult for them to self-isolate and quarantine. Let me give you some specific examples of what I'm talking about here. I'm talking about non-elderly adults that live in group homes. We know that a substantial portion of the chronic long-term homeless population are people with mental illness and substance use disorders. So if you are unsheltered homeless or even sheltered homeless, where you've got 100 men living in close quarters in a homeless shelter, it is impossible for you to self-isolate, let alone quarantine. Also know about this population is they have dramatically higher prevalence of respiratory disorders like COPD and asthma. They smoke at a dramatically higher rate than the general population. So for this population, they're at dramatically higher risk for contracting the virus and also a dramatically higher risk of bad health outcomes if they get it. So we're particularly concerned about that population. We're worried that policymakers are not nearly as focused on that as they need to be.
What is NAMI advocating for? I mean, what are the policy priorities that we should be focused on as a community to make sure that we're protecting those vulnerable populations?
So a couple of things. Number one, there is a decent amount of money that's already been put toward this. There's $4 billion that was in what we call the CARES bill, which was a third legislative package that moved through and was signed into law by the president. This money, what's very, very important is that when you have programs like this, and I don't want to go into detail about all these programs, but the agencies have waiver authority to split so that money can be spent at the local level in the most flexible way possible. So, for example, the $4 billion for the homeless programs that HUD was put in, there's specifically guidance that's already gone out telling local providers you can actually use this money for a 14-day voucher so that someone can self-isolate and quarantine in a motel room if they've been tested positive for the virus. So making sure that there's flexibility to address direct needs, particularly for people who are in situations where they need to protect the rest of the community to self-isolate and quarantine, that they have the tools to do that.
Sure. Excellent. And just last question for each of you, and we'll start with Carol. I think we're very focused in this country right now, and certainly here in Washington, on addressing the short-term crisis. And what we're seeing day to day, it's moving so quickly, which is obviously extremely important. But talk to us, I'd love to hear from each of you about what you see as the long-term implications from each of your respective perspectives on the pandemic. And what do you think the policymakers and leaders in healthcare should be thinking about in terms of not just long-term impact, but how to address long-term challenges going forward? And we'll start with Carol.
Great question. This is just a collective traumatic event that I think is going to have a strong and long impact on how we experience our lives, post-COVID. I think that people are going to be hypervigilant to interaction and touching. If someone sneezes or coughs, I think people are going to have a strong response to that. Almost like we have to learn, Andrew, how to reconnect with one another when we get to the other side of this. I'm probably not the best one to comment on policy, but I do want all of us to really impress upon ourselves that there's a lot of vulnerable folks out there, including the populations that were mentioned thus far, but also the elderly and people with advanced illness. So nothing like the present time to reach out and make sure we're making connections with those folks.
Excellent. Thank you. Lynn?
We know from the data from previous pandemics, whether it's Ebola, SARS, that there will be long-term mental health outcomes for all of those people who've been directly impacted, and even some who've not been as directly impacted. So we need to think not only about what do people need now in terms of their mental well-being, but we need to be prepared in the future for that as well, that there will be higher rates of post-traumatic stress disorder for individuals who've really had adverse experiences from the quarantine, from the people who've been on the front lines providing care. But I also have hope that because we know this, that we can be better prepared to meet the needs of these individuals with the kinds of interventions that are going to be most helpful to them. So I do think that there are things that we can be preparing now so that long term, we're in a better position to help the people who are going to continue to need help.
Excellent. Thank you. And Andrew, what are some of the long-term policy impacts. I mean, it seems like our healthcare system and the way that we pay for healthcare in this country is just changing so rapidly. As you look into your crystal ball a year, 2 years out, how is this going to impact from a policy perspective? What are the long-term effects?
Well, certainly going to reveal the fissures, the gaps in our public health system that need to be addressed. And that's really, really important because I think that's coming through on a daily basis. And when you hear about capacity for ventilators and protective equipment and all those other things. On a more optimistic note, I will say this, to the extent that people are watching these nightly briefings, I think there's really potential positive outcome here is that the sort of nightly lessons from Dr. Birx and Dr. Fauci and educating the American public at large about some of the issues here in terms of learning about public health and learning about what effective treatment is and what people need to do and actually making them healthy over the long term. To the extent that people are watching those and paying attention to Dr. Birx and Dr. Fauci as opposed to some of the politicians that are up there talking on television, there's some real benefit that can come from that. Just learning about health and public health.
Excellent. Well, look, Carol Fisher, Dr. Lynn Bufka, and Andrew Sperling, thank you so much for joining for the Health of It today. We just so appreciate your perspectives, and we're looking forward to staying close in touch.
And here is our industry foresight.
This is Jean Dessa, Senior Partner at Healthsperien and President of Healthsperien X. Our team at Healthsperien has barely been able to catch our breath given the maelstrom of regulations and legislative action has been ongoing in the Congress and in Washington since the beginning of the COVID crisis. I've been focusing on the massive spending activity under the CARES bill, the implication for the sector as all of this money flows from the federal treasury coffers to actors on the front lines. My experience, whenever there's large and rapid injections of funding in the healthcare sector, it necessarily transforms it. And it creates other challenges in terms of winners and losers, accountability, and it raises questions of how effectively funds are being spent and targeted. Specifically, I'm looking at the state COVID fund, where the feds will cover $150 billion of state and local needs for incurred amounts through the end of the year related to COVID. Questions are arising as to how states are going to use this money, how much will really flow to affected areas in need, how much to vulnerable populations, how much to cities versus rural areas. In this and in any crisis, the speed of getting resources to people in need has the greatest value. When we are through this crisis, what will we see in terms of value creation? Lives saved, of better investments for the future capacity building in the healthcare system. I'm also looking at the $100 billion fund for hospitals and other healthcare providers. Our team is closely watching regulatory activity related to this fund. Lost revenue is happening throughout the healthcare sector as actors are spending money on PPE and infrastructure. We're also looking at how hospitals are going to be using this fund to address lost revenue from elective surgeries. Many questions are arising about how that will be calculated by the administration. They're also of interest in terms of what that does to support hospitals' capacity in the future. We're looking how the funding is helping the full sector as well, beyond hospitals, post-acute providers, long-term care, home care, but also what has now become the front line of healthcare. Community health centers, urgent care clinics, retail clinics. Changes in the last decade in the healthcare system have moved care out of hospitals. Questions remain about how emergency funding paradigms are aligning with that. In many other areas in healthcare, COVID is making us reconsider what is effective preparedness, what is effective response in crisis, and where financing investments in the sector need to be going forward.
For our last segment, here is our outlook for the week ahead.
Hello, my name is Melissa McHale. I'm a health policy analyst at Healthsperien, and I'm going to be talking about some of the key things to look out for in the week ahead. First things first, we're seeing overall in reporting from the White House Task Force, as well as some state governors in metropolitan areas like New York City, we're seeing a slight slowdown of increased cases and deaths. Just it's stabilizing ever so slightly, not necessarily indicative that things are going to start declining. But with that said, experts are also anticipating that cases are going to start rising in more rural areas. So places in the Midwest, as well as the South, rural health systems are going to be impacted as we're going to start to see cases become more serious in rural areas, and that will affect those respective health systems. In the meantime, with what's going on Capitol Hill, we know Congress is currently in the process of deciding what's going to go into the, quote, phase 4 of the coronavirus spending package, which some lawmakers are referring to as the CARES Act 2.0, because what they're really aiming to do is to build on and expand a lot of the provisions that exist in the third package, which was known as the CARES Act. However, there's been a lot of partisan back and forth on the components that they want to include in this fourth spending package, and current systems on the ground like hospitals and small businesses and state and local governments, they need financial assistance from the government immediately. So Senate Minority Leader Chuck Schumer and Speaker of the House Nancy Pelosi both have released a statement saying that they would like to do a, quote, interim emergency spending package, which is meant to allocate funding, critical funding for these institutions. And they would like to include a $500 billion spending package. $250 billion of that would go to small business loans. $100 billion of that would go to hospitals, community health centers, and health systems in general to help them assist with containing the coronavirus, and also to help them be able to get critical resources like mass testing, as well as personal protective equipment and other just critical resources and supplies that they need to treat patients and to contain the virus. This would also include $150 billion to state and local governments to help offer resources to contain this virus. This would be an additional $150 billion to what was initially executed in the CARES Act. So state and local governments would be looking at getting potentially $300 billion to help assist with helping treat, minimize the coronavirus. And the last thing that the Democratic leadership proposed in this interim package was a 15% increase in SNAP, which is supplemental nutrition assistance, to help people who are currently not working and are struggling to keep food on the table. Now, some of these components they want to pass in this emergency legislation before focusing on the phase 4 of the corona package, because there's just an urgency in getting more funding to hospitals, state and local governments, as well as small businesses. But it's unclear at this time if this plan will get bipartisan support. With that said, I would kind of segue into the last thing to look out for, which is kind of the future of hospital funding specifically. Earlier in last week, we heard Secretary Azar stated that the $100 billion that was allocated to hospitals in the CARES Act was going to also be used to help pay for uninsured people to get access to coronavirus treatment. Following that statement, Kaiser Family Foundation released a report stating that the cost of covering treatment for uninsured people would be 40% of the $100 billion allocated. So given the current circumstances, which is that hospitals are in dire need of more resources and supplies, Congress will likely have to allocate additional funding to hospitals to compensate for that 40% that's going to be going to uninsured patients. So we're likely going to see in the future more funding as well as more critical engagement between stakeholders on how they would like that funding and how much would be needed. So that's everything to be watching out for this coming week.
That concludes our episode for this week. Thank you for tuning in. If you have any questions on anything you heard on this week's episode, please head over to healthsperien.com for more information and deeper analysis. And as always, tune in next week for more health policy insights and discussion.